with my non-dominant hand with my iodine-soaked cotton balls. Okay, so it's all on my cotton balls. I'll grab one cotton ball, and then I will use it down the majora, and then dispose of it. Get a new one, go down the other side, labia majora, dispose of it. Then I'll open up and get the labia minora, one side, dispose of it. The other side of the labia minora, dispose of it. Then I'll go down the clitoris, down to the anus once, and then dispose of it. Keeping my hand here while I'm still exposing the urethra, I will grab my catheter with my dominant hand. Ooh. Make sure I have all this off it. Okay. My dominant hand, my sterile dominant hand. And then I'm going to insert it with lube. I don't want to use my lube right now because I'm going to act like I'm using lube. So, okay, so I'm putting lube on my catheter, lubricating my catheter, and then I'm going to tell my patient that they're going to feel some pressure whenever I insert it, and that whenever I start to insert that I want them to bear down. So I'm going to start inserting it, and then I'm going to have them start to bear down. And then while I insert it there, I notice that there is a flash of urine. So once I see that there is a flash of urine, I'm going to insert my catheter another 2 inches, about 2 inches. Okay, so I inserted about another 2 inches. Then I'm going to hold this catheter with my fingers like so. And then I'm going to insert saline solution into the balloon to make sure that it stays in place. So I'm going to insert right here. I'm not actually going to insert, but I'm going to act like I'm inserting. Okay, so I'm inserting saline solution to my balloon to make sure that it is snug and in place. Okay, now I'm going to pull on the catheter just gently to make sure that it's snug and in proper position from the balloon. And then it is. Okay, so then after that, I'll raise the side rails of the bed. I'll remove my gloves. I will perform hand hygiene. And then I will make sure that I secure the catheter with tape to my patient's leg to make sure there's no pulling or any sort of discomfort or like snagging of the catheter whenever they're moving around. And then I want to make sure that I put the catheter bag below the bladder so it can drain out properly, because if it's at the bladder or above the bladder, then the urine can go back into the bladder and then cause for infection, and we do not want the infection. So then after that, I will clean and dry the perineal area again once more to make sure that it's all clean and good for no infections. And then I will remove gloves and perform hand hygiene. Okay, and then after inserting, and it's time to remove it, I'm gonna come in the room and tell them why we're removing it, that we don't want it to be in longer than it has to be, that can create a reservoir for infection and so forth, and we just want to remove it. So we're going to inform the patient that we are going to start removing the catheter, and we're going to expose them back in the same position that I had whenever we first inserted the catheter. So first we're going to remove the tape on the leg and remove the catheter bag and so forth to make sure that we don't have any other problems. We're going to remove all of that so we don't have any urine going back in the body or anything while we're removing it. Next, what we're going to do is that, because you can't remove it without deflating the balloon, so we're going to deflate the balloon. We are going to pull out the saline solution and deflate the balloon. So once the balloon is deflated, we are going to slowly and gently pull the catheter out of the patient while having them exhale while we are pulling it. So have them exhale and pull it out. So after we removed it, we want to make sure that we are assessing the perineal area. We are assessing the catheter for any type of blood or any type of abnormal colored mucus or anything that just looks abnormal for any signs of infection. So once we are done with that, we're going to remove and discard all the catheter kit. We are going to remove our gloves in the proper waist bin. We're going to put side rail up with the patient in the bed, and we're going to perform a hand hygiene. Then we are going to put gloves back on, and we are going to take the urine from the bag into a cylinder, and then we're going to remove the cylinder into a certain biohazard trash receptacle. And then we're going to remove gloves, perform hand hygiene, raise rails of the bed, and so forth. And then we're going to make sure that the patient is comfortable. We want to always reassess the patient's comfort and pain level. Then we want to make sure that the bed is in the lowest position, the bed is locked, the call light is within reach, and then make sure that they are comfortable if there's anything else that we can get for them, and then perform hand hygiene, and then you're done with it.